New HIV diagnoses among young people are on the increase. Since 2000, new diagnoses among young people have gone up by nearly 50%. Among young gay men, they've more than doubled. The reasons for this are not a mystery. The fact is, a lot of kids are growing up ignorant of HIV. This ignorance is leading to more high-risk behaviours, such as unprotected sex, which increase the likelihood of HIV transmission. Ignorance also fuels myths, for instance about transmission, which can in turn lead to increased stigma and discrimination of those living with or affected by HIV. This stigma can isolate and alienate an individual, erecting barriers to testing, to treatment or to partner notification. All of these serve to undermine prevention efforts. The education that young people receive in schools has a crucial role to play in battling this ignorance. As a generation grows up without the memories of the widespread health promotion messages of the 1980s, it's never been more important that kids receive reliable HIV information in the classroom. Unfortunately, the current standard of HIV education is simply not up to scratch. In fact, it's actually a little bit rubbish. 1 in 4 young people learn nothing at all about HIV in school. Even when young people do learn about HIV, this is often patchy or incomplete information. It's focused largely on the biological side of transmission, but it neglects the social aspects such as stigma, discrimination, and relationships. That's why NAT and our activists are fighting for sex and relationships education to become a compulsory part of the national curriculum for both primary and secondary schools. The House of Lords Select Committee on HIV and AIDS in the UK has just made a similar recommendation.